quick checkup on you, make sure everything is okay. But first I'm going to check your band and make sure that I have the right patient. I know who you are, but I just want to make sure, and then I'll check your baby's band as well, make sure it matches up. Okay, then I will wash my hands and put gloves on. And to start, I'm just going to grab a set of your vitals. So I'll get your blood pressure, and then after that, I'll take your temperature. Good. Okay, and check your pulse. Good. Okay, and then I'll watch her respirations as well. And then I'm just going to take a quick listen to your heart and lungs. Okay, that sounds good. Are you having any pain today?
Yes, a little bit down here.
Okay, so that's probably from your uterus contracting. So that's normal to feel pain. What would you rate your pain on a scale of 0 to 10, with 0 being no pain and 10 being the worst pain?
Probably a 2.
Okay, so do you feel like you need anything to take care of that? No. Okay, if it gets worse, just let me know and I'll give you something to take care of the pain.
Okay.
So I'm going to have you lay down on your back. Yeah, you can hold your baby with your knees flexed a little bit. Okay, perfect. Are you feeling any dizziness or having headaches at all?
Nope.
Vision problems?
Nope.
Okay, that's good. Now I'm going to look at your breasts, and I see that your nipples are not cracked or anything, which is good.
Mm-hmm.
I want to stress how important the baby's latch is when breastfeeding, because that will prevent that from getting cracked nipples and the soreness. And your breasts, they probably feel full right now, they will feel fuller as your baby grows, because your milk production will grow as well. And right now you're just making colostrum, and it's not very much because the baby's stomach is only the size of a cherry right now. And so when breastfeeding, if you notice any pain or redness in your breast, make sure that you call us, because that is a sign of mastitis, which is an infection of the milk ducts in your breast, and that's not normal. So if you experience that, make sure you give us a call. And for bras, just make sure you have a supportive bra, but none with an underwire. Okay? And I'm just going to give you this cream. It's lanolin cream, and it's basically just chapstick for your nipples, so you can apply that. It doesn't do anything to the baby, so it's fine. You don't have to wash it off or anything like that. So I'll just keep that here for you.
Okay.
And now I'm going to listen to your bowels. Okay, good. And then I'm going to bring in some Colace for you later on, which is a stool softener, and that will just help with passing stool, because you don't want to strain anything in your peri area after you've just had a vaginal birth. So now I'm going to have you hold baby just a little bit higher. Okay. And I'm going to massage your fundus, which is the top of your uterus.
Okay.
And before doing this, I would, if my client hasn't voided already, I would encourage them to void. because a full bladder can move the fundus off to the right, and I'm going to be pressing down. So, and then I'll say, like, if they experience any burning pain as they void, that it's just the urine getting on a little bit of that laceration, and that will sting. So I'm going to put one hand above the symphysis pubis and then one hand on the fundus, and I'm just going to massage with the flat part of my fingertips around, and I want to make sure the fundus is firm and midline at the umbilicus. And your uterus, that's what's causing the pain, is it's contracting right now, and it will contract until it gets down to that normal size. And it should go down one finger length a day. And then as I massage my client's fundus, I'll watch for any clots being expelled. And I want those clots to expel, because if they get too big, then they can't expel, and that will be bad. And then I'll also be sure to assess my client's peripad, and mild to moderate bleeding is okay, but if my client is soaking more than one pad in an hour, then I would tell her to notify us, because that's not a normal finding. And right now your bleeding is going to be bright red, but as the days progress, it'll get darker and then eventually a light pink color. But it should get lighter as the days go on, not heavier. And if it does get heavier, be sure to let us know. And then after I massage the fundus and check her peripad, I'm going to check her peri area, because my client had a vaginal delivery. So I want to assess her laceration or tearing and make sure that the stitching is well approximated and that there's no signs of infection or anything like that. And if my client were to have a C-section, I would also assess her incision and make sure that it's nicely approximated and there's no signs of infection either. And then I'll also make sure my client has a good skin color and that she's not diaphoretic or anything. And then I'll ask my client if she's experienced any leg pain. Do you have any leg pain today?
No.
Okay, that's good. So, and she doesn't have any edema. If she were having leg pain, that would be a sign of a blood clot, potentially, so, which would not be a normal finding. And then I will ask my client what kind of support system they have, like going home to. So do you feel you have a good support system?
Yeah, I have my husband, and then my mom said she'd be willing to help.
Okay, very good, very good. What did you name your baby?
Allie.
Allie, oh, that's so cute. And I can see you like to hold Allie. And
Yeah.
so I can see my client has a nice connection with her baby, and she's interested and likes to care for it. And then I would ask my client if she has any questions for me. So do you have any questions for me right now?
Not right now, no.
Okay. And then if you do, just let me know. And then I'll also make sure to take into consideration my client's cultural practices, and while I'm doing the assessment. And then I will wash my hands and document my findings.